Hey, I just wanted to introduce myself. I am Regina. I'm 32 years old, and I started this with the intention of it trying to help me get through some of the things that that I've been going through, and then I'm gonna be continuing going through over the next few months. So basically, what's going on is about a year ago, I got really sick. Well, actually, I shouldn't say that. It was over a year ago now. I got really sick. I ended up going in the hospital. I was septic. They treated it. And then after that, I felt good for about 2 weeks. And then I just kept getting sick. I had pneumonia 5 times. I just really, there was pneumonia. And then I went into like a back problem. I don't really know if that was related with it, but this is a bunch of crap. One doctor told me, mind you, this is in my hometown. One doctor told me, you have heart failure. And so I was like, oh my God. And then this was in March. So I was like, okay, not the best thing you want to hear, especially at the time I was 31. So of course I go and I see the cardiologist that's in town here. But I think I had to wait for 2 weeks to get this appointment. I go in there. He basically laughs me out of his office and tells me, you don't have heart failure, you're too young. So then I was like, okay. I take his word as gospel because I'm like, all right, well, you're a doctor and you're a cardiologist and you must know what's going on. But then I just kept getting sick. I was gaining so much weight. And like I would be swelling. And people were like, oh, it's just the food that you're eating. And at the time, I mean, pretty much for the whole time, all I could do was vomit. I would drink water and I'd throw up. Is pretty much a glimpse into what my reality was for a very long time. So at that point you would think, well, I wouldn't be gaining weight, I would be losing weight. Not that that was my goal, to lose weight by vomiting uncontrollably all the time. So then what happened is in this September, this just past this September, actually it was the 26th because it was my ex-boyfriend's birthday, and I ended up being sick that entire weekend. It was bad, and all I remember feeling is like swollen. The best way I can describe this is I felt and looked like, without the coloring, Violet from Willy Wonka. Remember how she blew up into this big blueberry or whatever? That's how I felt. I ended up going to the emergency room here in Fond du Lac, and they told me, we think it's your gallbladder, right? That's what they told me at that time, yeah. So I'm like, okay, and they're like, you need emergency surgery. And I'm thinking, okay, I need surgery. This whole time, all these symptoms I've been having for this long has been my gallbladder. This is going to fix this. It's going to be better. I'm not going to feel like crap anymore. It's going to suck. I've never had surgery, but it's going to make it better. You know, so this is what they've been telling me. So apparently my symptoms were like to a T, this thing, and they had done this, I think it was a CT scan or something like that. Of the gallbladder, and apparently I had this giant gallstone, and it looked angry, and the blood work, and all this other crap, and sorry. So, you know, I tell the boyfriend at the time, go home. You know, it was his birthday. It was like 4 in the morning. We were there forever. So I'm like, we're admitting you, obviously. So they admit me, and then they bring me up to a room, and I'm not allowed to eat or drink anything. I had called my mom, and my sister, one of my sisters and my brother came, and I'm like, hey, I'm going to be having this surgery, you know, hopefully, and I'm scared. I don't want to be here by myself. And they come, and they send in this god-awful doctor, who apparently is the general surgeon at the time, Dr. Novak or something. He was so rude to me. Basically, okay, I've been a big girl all my life. I'm not ashamed of it. I don't eat horribly. I really don't. I mean, there's been... Okay, there are times when I do eat horribly, but you cannot tell me that none of you do. But I'm 6 foot. I carry my weight very well. I mean, a lot of my weight is in my midsection, you know, and I'm showing him these pictures from my birthday, which is in August, and then I'm like, hey, this is what I look like, 3 or 4 weeks ago at my birthday party, and this is what I look like now. You cannot tell me that I have gained nearly 75 pounds in this short amount of time because of what I'm eating. I find that physically impossible. Don't ever want to find out, but whatever. But he was, you know, well, I can't do surgery on you. It's just, I'm going to have to cut you from here all the way down to here. You're going to have this huge thing, and now you're diabetic, and you're just not going to heal. And, you know, so what I'm going to do is, I'm not sedating you, but I'll, you know, numb you, and we're going to make an incision by your gallbladder, and I'm going to stick a tube in there, we're going to drain all of this crap for 6 weeks. You're going to have this tube hanging out of you, and we're going to drain it, and then, you know, it's just too much of a risk because of your diet and everything like that. At this point, like, I'm so sick of all this crap because it's been over a year. Over a year. I don't, with no answers. I mean, no legitimate answers. Nobody can tell me for certain what the fuck is going on. I saw specialists, I saw dietitians, I was put on, I don't even know how many different types of insulin. I saw cardiologists, I saw you, blah, 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 blah. And I'm telling you, like, I was at my wit's end at this moment. Basically, I told this man to get the fuck out of my room. He comes back sometime later and apologizes. So anyway, I'm there, I'm doing all this crap. I can't keep anything down, and I can barely move. I mean, it felt like I was going to burst, like split open, because I'm just swelling, and I keep gaining all this weight, and they're seeing I'm not eating, and then they're telling me I'm having these liver problems, and next thing I know, I don't remember a lot. I got really sick, and they ended up shipping me down in ambulance to Froedtert Hospital, which is in Milwaukee, about an hour from here. Now, Froedtert is excellent. Excellent. It's like a college. It wasn't exactly, it's called like a medical college or something, I don't know. And they have specialists there who, you know, deal with not only, you know, obese people that may or may not need surgery, but everything. They have excellent cancer facilities on there. They have these children's, it's great. If you have time, look it up. Okay. So I'm there, and they ended up putting me in ICU. I was in ICU for about, I think it was a week, but I'm not sure because I can't really remember anything. What had happened is they figured out everything that was going on. Apparently, for this past year that I've been in the hospital, in and out of the hospital, I should say, because every month I was in the hospital for some sort of a stay. They've been putting me on all these antibiotics and stuff, so what it's done is it damaged me, and I ended up having C. diff from it, which, if you don't know what C. diff is, I'm not going to describe it. You need to look it up. It is disgusting, and it is miserable, and I wouldn't wish that upon my worst enemy. So, then, they were also prescribing me, hi Katie, they were also prescribing me ibuprofen constantly. And again, I'm not really sure what it was for, but what that had done, it actually damaged my liver. So I was actually having my liver was sending out this thing. So I'm never allowed to take ibuprofen again, apparently. And then basically, they sent in the heart team. They were doing all these like echoes and scans and stuff. And in ICU, they actually come to your room and do it. So they did all this stuff in this really, really tiny room. They come to find out that Regina does have heart failure. So this man that told me and laughed me out of his office, this cardiologist, Dr. Diaz, and I don't care. I'm going to say their names now because I think people need to realize second opinions, if nothing else, are very important, okay? Third, fourth, seventh, whatever, until you hear the same thing over and over again, that yes, this is what you have, yes, this is what you have, when you constantly don't feel good. And I wouldn't even, I would do those extremes. I would, considering what I've been through. So apparently he was wrong. He was very wrong. So in effect of him misdiagnosing me and dismissing me completely, and all these wrong answers and everything that had been going on, this heart condition that developed from their assuming when I went septic in December, the weakened the heart, it had gradually decreased the function the function on the right side of my heart for a year plus. So I wasn't delusional. I knew something was wrong. And that's another point I want to make. If you know something is wrong, if you know, follow your gut. You know, doctors nowadays, not all of them, but what I've come to find, a lot of doctors nowadays are so quick to dismiss people and listen. They don't listen. They're just like, well, you know, they're very stubborn. You know, I understand you went to school. How I did hair for a really long time. I loved it. You can't do it anymore, obviously, for all the conditions. But, you know, I knew my shit. I know my shit when it comes to that. And so they know their shit. But even though I knew my stuff, I don't deal with your hair on a daily basis, okay? I don't wake up every morning and wash it or brush it or style it. I do not know, other than what you tell me, you know, your hair does on a day-to-day basis with irons and humidity. You know, I can estimate, I can guess, I can make assumptions, I can jump to conclusions because of the training that I've had, the condition of your hair, what type of hair you have, of what could happen. But I don't know for sure because I am not you. So I would take the time and I would listen and I'd analyze and I'd try methods that I know would work, that sometimes did not work, and then we'd move on. And that's what I think doctors should do with patients. These people completely dismissed me. And I don't think that that is fair. I don't think that I am less of a person because I don't have a medical degree. I know my body. I know that there are things wrong with it. I know when things hurt, or you know what I'm saying. So they were wrong. So I wasted a year and allowed this disease to slowly deteriorate my heart. And then rapidly, every time I got sick, it would happen more. So now what's happened is I have what they call chronic systolic heart failure. From my explanations from my wonderful, and it's a team of doctors. It's not just one, it's a team. I mean, I've got like 10 people on my team, okay? What I found from this is that basically the right, I think it's the right chamber, but the right, I'm just gonna say the right side of the heart, right side of the heart, it doesn't expel all the blood, the liquid, okay? So what that does is the blood and the fluid surrounds the heart. So that's where you get congestive heart failure, okay? Now, congestive and systolic are different, apparently. Congestive heart failure is where you're basically, your whole heart is drowning. And I guess with this one, what it is, mine doesn't pump the way it's supposed to. So that's why I get so winded. That's why I'm so tired all the time. And it's I feel like an old woman. So what they did is they put me on this series of medications and laxatives and, oh my God, diuretics. I mean, you want to talk about pill that works. I mean, this concoction of diuretics. Basically, those are the only ones, and the blood pressure medication that have been working since, well, I guess October when I got discharged. Or I've lost 100 pounds. This is all water weight. So this is exactly what I was talking about. So what is today? Today's February 8th, I think. So since October 5th when I left to now, I've lost a little over 100 pounds. But the heart medication isn't working. They've tweaked it. I've gone in several times. I had a heart catheterization in October. And if you don't know what that is, that's where there's a right and a left heart catheterization. The right heart catheterization, they go through your wrist, and it's semi-sedated. I have to be because I will freak out. But they go through my wrist, and then they feed a tube. That's my dog, sorry. They feed a tube and it goes all the way here, and then they can read the measurements of like the liquid or something like that. I'm sorry if I'm getting some of this wrong. And then the left one, they actually have to go through your neck, and then that goes to the left side. So they did all that, and then according to that, they prescribed me medication, of course with the echoes and all that stuff. And then they tweaked it over time, so they've upped my doses, they've changed them around, and it's not working. So as of the 24th of January, I went in for a second echo there, and with that, they found that my heart, since September, my heart was running on the right side at less than 20%. That's pretty bad. So now it is, so it was at 15%, and now it's at 13%. So obviously something's not working. So what we've decided to do is actually on Monday, which will be the 13th, I'm being admitted to Froedtert Hospital. They're doing a heart catheterization, just the right one, so that's good. They don't have to go through my neck. Right heart catheterization, and and then they're admitting me after that to do like this IV 24/7 fluid reduction. So it's gonna be Lasix, and it's like this concoction they're gonna put in me that's gonna help the right side of my heart pump the way it's supposed to. Now this isn't a fix. This is just to remove most of this liquid. We were talking about doing a heart defibrillator for a long time, and what my doctor now has recently brought up is that, definitely surgery is going to happen because nothing is getting better. They're going to actually do open heart surgery, and they're going to put a pump, well, I shouldn't say, they are striving to put a pump in the right side. So this is major surgery. And then after that, you have to be at a certain weight before they can put me on a transplant list. So eventually I'll be put on a transplant list. So basically, that's my backstory of what's going on. I don't know if anybody's going to watch this. And I know this is a long video, and a lot of it is rambling in background, and I don't even know if I clearly know why I'm doing this. If it's just to get the word out that if other people have been misdiagnosed and had to go through things like this, it's not okay. It's not okay to be dismissed by people that you have always been taught to trust in your life, like doctors. It's not okay to not listen to your patients, and in result to that, things can be a lot worse. And who knows if this would be what it is. And I can't do these what ifs anymore. I just can't, because it's driving me crazy that I'm doing this. But there's no guarantee that it wouldn't be like this. There's also a really big chance that I wouldn't be in the situation I'm in if they would have just listened. So my plan is to do a daily blog kind of like this, or at least updates. I'm going to be in the hospital for about a month before even surgery happens. And I want people to, interact that kind of know what I'm talking about, whether it's heart failure or health conditions where they feel that they've been wronged, a support system. Excuse me, I'm so sorry. A support system is really what it is. And I just know that everything is stronger in numbers. So my sister did this for her fertilization. She's trying to have a baby. She got a lot of really good responses, and I don't need rude comments. Keep them to yourself. If you're not here to be positive or relate, I don't want to hear it. I don't care really what you have to say. If you're not on a supportive level or related level. But I just wanted to, give you backstory and let you know I'm going to be updating stuff. I think I'm going to post something tomorrow about all the paperwork I had to go through. It's not fun. But, we'll go from there. But welcome. Please feel free to leave comments, follow if you'd like, invite people that you maybe or yeah, we'll go from there. I hope you have a good day. I'm so sorry.